May is Mental Health Month, and it's more important than ever now that we're all dealing with the emotional consequences of the COVID-19 pandemic. I'm Lee Kelso. Welcome to HealthCall Live Online, the place for extended interviews that we feature in our weekly radio broadcast, the HealthCall Live Radio Hour. So let me welcome to the program today Paul Gionfriddo. He is the CEO of Mental Health America. And what a good time to have you on the program, Paul. Thank you for joining us.
Hey, thanks for the invitation.
Absolutely. Tell me what I need to know about COVID-19 and mental health status of America.
Well, as a result of the pandemic, the mental health status of Americans has really declined. So many people are affected by this. 100% of us are worried. We're uncertain about the future. Many people have lost jobs. Many people now have lost loved ones. And the reality is that for many of us, this worry is transforming to something worse, to clinical anxiety or depression or post-traumatic stress. And this is something we need to be aware of, something we need to take seriously, and something we really need to do something about quickly.
So what is there about COVID that is so much different than anything else that's come along that we've had to struggle through?
Well, when we had the stock market crash in 2018, that's all we had was a stock market crash. And so people got through that pretty quickly. The stock market rebounded and we went back to normal. And when we've had other viruses that have come about, whether it's the seasonal flu or whether it's been some of the other scares that we've had around SARS or H1N1 or swine flu or bird flu, all of these things have passed fairly quickly, but this has been a double whammy. This has put people's fear for their own health and lives and fear for their livelihoods together in one package. And it's made it extraordinarily difficult for everybody across the board, particularly young people.
So what is the first thing that I should be doing about this? One of the things I know you advocate is don't guess about whether you are being affected. Take a test.
Yeah, I get the question all the time. What can I do? How do I know if this worry that I'm feeling is different or something I should be concerned about? And I tell people, don't guess. We offer free online mental health screening tools that people can use anonymously. They're the same tools that are used by clinicians in offices. You answer a few questions and you get an immediate result. And it'll take the guesswork out of it. Beyond that, we give people customized results based on the screen that they've taken and the result that they've gotten on the screen. But for me, it goes back to whether people take them on our website or take them somewhere else, take a mental health screen and learn for sure about whether or not your worry is something more serious than something that's just going to pass as the pandemic passes too.
So what if it is more than a passing sense of fear? What can I do about it? What help is out there and how can you help me find it?
Well, interestingly, people generally are looking for four things when they take a mental health screen. And I can help them with all four of those things in different ways. Some are looking for referrals to providers, and those are best gotten locally, although with virtual mental health services now, there's more expansive opportunities that insurers are paying for. But the other three things people are looking for is just more information about what it is they've got, what is anxiety, what is depression that I'm dealing with. Second thing they're looking for is do-it-yourself tools. How can I keep myself healthier? A young person might want an app. An older person might want some materials that they can download, worksheets that they can work on. And the third thing they're looking for is engagement with people like themselves, with peers. In other words, a 17-year-old wants another 17-year-old to talk to who's gone through the same thing. A 60-year-old wants another 60-year-old to talk to who's gone through the same thing. And we can connect people in virtual environments these days. So we can give them at least something in each of those four areas.
A 17-year-old doesn't want to talk to some guy with gray hair like me.
Or me.
And this is or you, thank you. And this is affecting young people more than I think many of us old guys really understand.
Yeah, when this pandemic first came to light, we all heard that it was going to mostly affect older people, and everybody expected, therefore, that older people would be most anxious and most worried about this. But as it turns out, and we have a screening population that comes every day, and during the month of May, we're not getting a small number. We're getting 5,000 or 6,000 people a day who take a mental health screen. It's skewed toward younger people. Now, that would typically be the case in our screening population because most mental health concerns emerge during childhood or young adulthood. But what we've seen in the pandemic is when we're looking at the severe anxiety, the severe depression that people are facing, it's the young people who are facing this more deeply. About half of people in our age group, older men, are experiencing this anxiety or depression deeply, but about 90% of young people, teenagers, are experiencing it deeply. So we need to pay attention to our young people in particular, even though we thought that they were the ones who were going to be largely immune to this.
They're the ones who could probably be most likely to take part in the Facebook group discussions, the Zoom call meetings, and that kind of stuff that I know you're helping to make available and that I will link to down below. But talk to me about what I should be looking for in young people. What are some warning signs that we should be watching out for?
Yeah, I'm glad you asked that. And if people go to the screening tools, they can really get the inventory and the questions and answers that are there. But just some things to be thinking about is a young person whose sleeping habits change. If they're experiencing way more difficulty going to sleep, way more difficulty, getting up in the morning, or that habit is changed, that can be a flag. Another flag will be a change in eating habits. That'll be a flag. People who become less active and more withdrawn, that can be another kind of a flag that people are looking for. So some of this, of course, is, we say, well, of course, that's what's happening because we're all isolated. We've all been staying at home together. So, tempers are frayed and people are more nervous and worried and all that. But just people should be attentive to just seeing these changes that may appear somewhat subtle. And hey, if they perfectly normal, you take a screen, you'll discover it's perfectly normal. But if you take a screen or have them take a screen and see something more, it's an opportunity to get a little more help.
One of the things that I read recently, and it made a heck of a lot of sense, is that the displacements in the workplace, so permanent layoffs, 25% of the people who have lost a job, those jobs may not be coming back is the latest estimate. And so when you do go back to work, you feel sort of a survivor's guilt. And there was a psychologist was urging organized workplace grieving. Employers may not want to talk about those folks who are no longer there, but I'm assuming you agree that it's important that people talk through that process.
Yeah, it really is. I mean, consider that right now, the primary mental health concerns that we're seeing are related to loneliness and isolation. But over the course of the coming months, they're going to be related to two additional things: the financial problems that some people have, and of course, how their family and friends who don't have those problems feel about that. And then the grief that people will face as they lose loved ones, and not just to death, but lose people from their circle of friends in their workplaces who are not there anymore, who've had an abrupt departure they haven't seen. So these are both things that people need to work through. These are not things that we easily adjust to all by ourselves. For a long time, especially men were told, you got to tough it out. You got to get beyond that. You should be happy. It's not affecting you this way. But the truth is that kind of survivor guilt will be faced by a lot of people. And they'll need to understand it's not their fault that they went back to work in a healthy way and that some other people didn't quite get there.
So where do I go in my community? And talk to me a little bit about how I pay for mental health care and where do I turn for it in small rural communities, some of those issues that we need to address.
Yeah, for people who still have insurance, public or private insurance, and hopefully even people who've been laid off have taken advantage of the COBRA benefits to keep their private insurance, it's really important to call insurers. These days. Even the answer they gave you a month or two ago is probably different today when you look to telemental health. So in a rural community in particular, it can be critically important that the telemental health provisions are now added to insurance policies that we didn't know about. In fact, Medicare just added them a couple of weeks ago. So, people can now take advantage of just a phone call, and it's covered under the Medicare program, and it hadn't been up until a couple of weeks ago. So I really want people to start in wondering where to turn by turning to their insurer and saying, what are you covering now that you might not have been covering even a few weeks ago? And then I want them to recognize and understand that there are a lot of free resources available too. Many of those are online. We offer them certainly online at the national level. We have local affiliates throughout Indiana who offer them at the local level. And even a lot of the groups and other things that were being done in person are still being offered virtually and generally are free of charge. So don't give up. I mean, there are things that people are going to have to pay for. Nothing's entirely free, or not everything is entirely free, but there are a lot of free things out there, either in the virtual environment or even, again, low cost through insurance that weren't available just a few weeks ago.
Had any type of mental health care, that taking that first step is scary, right? It's tough to jump to somebody I don't know, get on the phone and admit that I'm really struggling.
Yeah.
But I guess the anonymity of the phone or online could potentially make that easier. What do you suggest is that first experience going to be like?
Yeah, if people do it anonymously, and for example, going to our website, taking a screen themselves, and then looking at the resources that come up afterwards, you can do it at your leisure and really begin to figure out what that experience is gonna be like for you and what it needs to be. Many people, though, have two options that they don't always take advantage of, and sometimes out of fear or the sense that in some way they'll be stigmatized if they do. One is talking to the family doctor. Most primary care physicians are really the ones who are the first line for people to talk to when they're needing clinical support and care. And a lot of people don't realize that your primary care clinician will help diagnose and can help prescribe the meds and manage the meds, even while people are waiting for a therapist who might be doing talk therapy with them, or a specialist like a psychiatrist who's going to monitor those meds and the reaction to those meds over time. And then the second thing is talking to family and friends. The reality is that so many of us, have experienced mental health concerns or conditions in our lifetime. About half of us will be diagnosed in the course of our lifetime, about 20% in any given year. I think a lot of people who are experiencing this for the first time will be surprised to find, if they open up to family and friends, that the family and friends have already gone through this and might have some good and useful advice for them.
Just mentioned medication, and I'm one of those guys who I just hate taking a pill for anything. And I know there are a lot of folks out there like that. Can therapy be effective without medication?
Sure. And that's the whole thing, that there are choices and options. Not only can talk therapy be available and helpful without medication, sometimes it's a combination of the two. And sometimes, it's a very gentle medication that people may take anyway. And in fact, most professionals, particularly the specialists, aren't going to go necessarily to medication first, and they're going to go to the most minimal doses that they can as well. Sometimes that can be unnerving to people because they don't see a result for several weeks. And sometimes the way these meds work, you don't see a result for several weeks. But people should not be turned off from the notion of getting help for their mental health just because they may be concerned that they may not want to take a medication as a first choice. One other thing to keep in mind is that not only are we talking medication, talk therapies, but many of the things we do to promote our physical health also promote our mental health. So if you think about exercise and the fact that we can get endorphins, they make us feel better. And if you think about eating well and having energy, that helps our mental health too. So people will also discover that even when they've got serious mental illnesses, serious mental health conditions, that there are things that they can do to feel better, even before they're talking about drugs and talking about talk therapies.
On that, we have documented on this program on a number of occasions the gut-brain connection, how the right microbiota in your intestinal tract can make a huge impact on how you think, how you feel, your energy levels, so many of those things. And you're right, that's all driven by exercise as well as what you put into your body. But if I am so depressed or just, curled up in a ball and just can't get the energy to get outside, what motivates me? What have you seen be effective in getting people to take that first step?
Yeah, and the hope is, of course, people won't get to that stage. Our mantra at Mental Health America is acting before stage 4, like we do with cancer or heart disease. Earliest detection, earliest identification, earliest interventions. They're most useful and when we're most resilient. And so let's say first, for all those who are not yet to that stage, you could get to that stage if you don't take care of yourself. So please take care of yourself and reach out for help when you need it. But for people who have been at that stage, oftentimes that's who we're seeing at Mental Health America. They get to a stage where they really do just say, I just need some help and I can't do this on my own. So what we need to do is recognize that we need to be willing to engage with them. So here's the thing. I mean, it's a family member likely or a close friend who's going to be noticing that level of withdrawal first and kind of comparing it to the way somebody was, maybe say months ago. And we need not to be shy about asking somebody at that time if they need some help. It's not going to make them, think that, okay, I've got to have suicidal thoughts now or something like that if I ask people if they're doing okay. But for somebody who is feeling that way themselves, the extent to which they recognize that is the opportunity they've got to just ask someone, do the one thing you can do. I often say to people, just do one thing that you can take control over and that you're not feeling is controlling you. And I don't, that may be just, lifting a hand to your face at some point, or, picking up a book, or just, getting up and taking a shower, just to begin to do one thing at a time that puts you in control of your life and takes the control out from, beyond you, that's important. So finding that little thing can be an important first step for people.
That's a great point. I do think that a lot of the stress that this entire pandemic situation has imposed upon us is because it is totally out of our control. You don't know whether you've been exposed. Are you going to be exposed tomorrow? Are you going to be one of those people with mild disease? Are you going to go into the hospital? Is your daily activity going to expose that elderly person who shares a home with you or who you care for? What we heard about the disease initially is not what we're learning today. There's just so much swirling information. It's hard to pick out really what's correct for your situation. So yeah, I think you're spot on with that one. I do indeed. If you were to recommend people to visit your website, and you have a special a website collection of resources, tell me the two that you think are most unique, most innovative, and you most want people to drop by and take a visit to.
Well, I obviously hope people will take a mental health screen. It's recommended. People don't realize this. Mental health screening on a regular basis is recommended by the U.S. Preventive Services Task Force for everybody over the age of 11. So whether you're feeling bad or not feeling bad, it's just recommended that we do it. Since our clinicians aren't doing it for us, even though they can be reimbursed to do it, we can do it for ourselves. So the first thing I hope people will look at is our screening tools. And especially because if you take a screen, as I've mentioned, you get all kinds of customized resources after that. The second thing I think people should look at is our Mental Health Month toolkit, also freely available to download. It's called Tools to Thrive. There's some COVID-19 specific material in there, but there's a lot of evergreen stuff in there too. And Mental Health Month is the biggest mental health awareness effort each year in the nation and the world. And we started it at Mental Health America back in 1949. So it's tried and true. The materials are new every year. But I think that's the second place I'd recommend people go, because there's just a lot of cool stuff there that can help people maintain their mental health.
Page 4, I like that a lot. Leave us with one last golden thought there.
Well, continue to live with hope and optimism. These are times of uncertainty. These are times of worry. These are times of concern. And we all know that. And we all know that we're all not going to make it through it in one piece. But we have to look forward, because we will come out of this on the other side. And we want to come out of it as healthy as we possibly can, both physically and mentally. And the best way to do that is just to continue to plan for and prepare for a more hopeful future. And I think that's the thought that I want to leave people with. It's the most important thing we can do for ourselves.
Paul Gionfriddo, thank you for spending time with us here on Health Call Live Online. Good thoughts. Good
My
work.
pleasure.
Appreciate you being here.
Thank you.